Before we get into our main topic today, I want to bring in my colleague from the Confed, Annie Bliss. I want to talk to Annie because one of the kind of issues that's really a lot of importance to our members we're finding as we go out and we talk to them as we do on a daily basis is kind of performance oversight and particularly uh, league tables, which maybe Annie can tell me, but I'm not imminent, I think, but I don't know quite how imminent. So, Annie, welcome to Health on the Line. Tell us first about what you know about the government's plans to publish league tables, and can you tell me more about the date, which seems to be shifting around all the time?
Absolutely. So we first heard about the reintroduction of league tables back in November, and then with the 10-year health plan positioning kind of easy to understand rankings as part of its plans to improve public transparency, voice, and choice. So I think really the intention behind the league tables is firstly to increase public transparency, which was announced in the plan and a big focus there. But a secondary aim is also to tackle underperformance and make sure that no more rewarding of failure. So that was something that was announced at the NHS Providers Conference. I think it's important just to make the point that league tables are part of a wider oversight and regulatory landscape, and see oversight and regulation play an important role in making sure that you can identify providers that are in need of support, ideally get ahead of the issues that are going to lead to poor performance and potentially safety issues. Um, so it's really important that is tackled in a robust way. Publishing performance data in the form of league tables is kind of one tool within the context of performance management. And so that tends to focus more on immediate issues like operational and financial performance. So it's really important that they look at the right things. Um, in terms of timescales, we're expecting the league tables to be published in the summer, so most likely in September. We know that they'll cover acute mental health, community and ambulance trusts, and it will be linked to the recently published NHS oversight framework, which has a shortened set of metrics to support rapid recovery.
So, I mean, my view, I mean, and I find the debate about league tables fascinating because I've been looking at these kinds of ideas and debates for 3 decades as I've thought about kind of public service reform and innovation. So the arguments are kind of well rehearsed. I mean, I guess my starting point on this is they are simply inevitable. In fact, I was reading the Yorkshire Post the other day, or the York Evening Post. That's just the paper for York, and it had an article saying best and worst GPs in York according to our readers. So the fact is, people are able to generate all sorts of details. HSJ, and week never passes without them publishing some kind of list that tells you who's the best and the worst. So for me, what the starting point is that this is inevitable. The question is not whether there will be league tables. And equally, if you're doing well in a league table, people will assume you're a good leader. And if you're doing really badly, people will assume you're not such a great leader. So it's kind of defying gravity to suggest that you kind of don't do this. But then equally, on the other hand, the gap between doing it well and doing it badly, doing it in a way that improves things for patients and doing it in ways which can actually kind of lead to perverse outcomes, that gap is huge. It's not whether you do it, it's how you do it. So, Annie, tell us a bit about the conference perspective on some of the key things we need to make sure we get right.
Absolutely agree, Matthew. So I think giving league tables the best possible chance of achieving, what they're setting out to do. So encouraging some healthy competition, increasing local accountability, so sharpening the focus on national priorities. The way we do that is to kind of make sure that they're not set up in a way that is intended to kind of just name and shame. They need to be designed thoughtfully. Um, I think it really obviously it matters what metrics you use, what behaviors you're incentivizing, what data is available to support that judgment, how the information is presented as well. So it's absolutely how do you take forward this approach. So, for example, while it's important to have clear rewards for good performance and clear consequences for underperformance, this needs to exist alongside a program of support which is tailored to organizations that are struggling and who might lack the capability to drive improvements on their own. So I think for us, we probably have some sort of considerations around whether that is being taken forward in the most appropriate way. So, you know, Do the ratings provide a rounded and accurate view of organizational performance? Is it clear and transparent to the public exactly what they will and won't do? And also, how do we look at past examples of league tables? So we've done this before, but actually, what metrics give us the most meaningful measures? What metrics can we look at from outside the UK? And how do we mitigate some of those unintended consequences, perverse incentives?
And I mean, Annie, I could talk to you for hours on this, but we've only got 2 more minutes. But one other concern I have, which you didn't mention, is if neighborhood health is going to work, if the left shift is going to take place, we are going to need organizations to work effectively together in the interests of the public. Is there a danger around league tables that they reassert the importance of organizational performance and they miss out the importance of integration and collaboration between organizations?
I think that's certainly a risk, and obviously the league table approach needs to align with some of the other levers for change that were in the plan. So financial flows, the national target, some of the things you've mentioned there. And in particular, there's a drive towards a more devolved model based on earned autonomy. So how do we make sure it kind of aligns with some of that? I think the most important thing really is that they do improve public transparency, and that they're also going to actually empower the public within the context of a wider set of measures to increase their agency and choice over their own health. I think that's one of the key things that we know the 10-year plan needs to do. So how do we make sure that the information is communicated in a way that makes sense, that's understandable to the public? And also, how do we make sure that the metrics are things that do matter to most of the public? Um, so obviously, it might be a reach to suggest that publishing a read table may change someone's choice if there is actually no choice in reality about what services people can use. So I think it's important that that communication is clear around what they can and can't do. Um, I think there's some considerations in terms of financial override, which sits within the oversight framework, and whether, how much that can be a consideration for the public in terms of what services they use. You know, as a member of the public, I don't necessarily care if the trust that I'm using is in financial deficit, but I do care if they're going to deliver high quality care um, for me or for my family members, for example.
Yes. Well, I think that's a good point to end on it, because I think eh, y- a bit of advice I would give to all policymakers is the more things you try to achieve with something, the less likely you are to succeed. And so if you've got league tables and you're trying to improve performance, you're trying to increase transparency, you're trying to inform the public, well, fine, but some those things might pull in different directions. So it's better to try to it's better to do a couple of things and do them properly than try to do too much and end up with something which in the end doesn't do anything properly. So a lot of work to be done. We're working closely with officials at the centre to try to help them to get it right. I think it's right, isn't it, Annie, to say this first iteration will very much be a first iteration, and these league tables will develop over time.
Absolutely.
Thanks, Annie, so much for joining me.